Welcome, viewers. For those of you just joining us, we've been talking about Meconium Aspiration Syndrome, and Dr. Uche Anne Nzelu has been doing justice to the topic. You're welcome to join us. Please also share the videos with your friends, and you can drop your comments directly under the video, not on the watch party. Welcome. Dr. Uche, over to you.
Okay, thank you once again, Sophia. I understand that I was disconnected at some point, and then some people were not following us anymore. So I'm going to go over what we had earlier discussed, and I'll introduce the topic all over again. So Meconium Aspiration Syndrome is the difficulty in breathing that occurs in a newborn after birth, and it's caused by the clogging up of the newborn's lungs by meconium. I'm sure a lot of us are already wondering, what is this meconium? So meconium is that dark green stool that babies pass after birth, typically in the first 24 hours of life, or at most by the third day. Every child should have passed meconium. So it's the poo-poo. It's the poo-poo. Maybe the poo-poo doctor should have been here. So it's the poo-poo that the child passes, the newborn passes. Now, Meconium aspiration syndrome will therefore occur when a child passes this poo-poo before he or she comes out of the womb, or while he or she is on the way out, or immediately, and then the baby takes it in, breathes it in, and it clogs the lungs. It shouldn't pass it inside while in the mother's womb. It should pass it after the child has been born. But for some reasons that are preventable, these children pass it inside the womb and breathe it in. It obstructs the lungs and it causes problems for them. So meconium, which is the poo-poo, I know you'll be wondering, but the child did not drink breast milk, but the child did not eat cereal, but the child did not eat any of these things. How did the child make poo-poo enough to pass it inside the womb? So that meconium is formed by that fluid that the child, when the child swallows that fluid that is swimming in, including water, that contains a lot of water, and the intestine. So the food goes through the mouth. Food goes through the mouth, to the stomach, to the intestines. The required part of it will be absorbed by the intestine. The rest will be passed out as stool or poo-poo or feces. So it's the same process, but in their own, what forms it is the fluid that they swim in, they swallow it. Now the intestine produces some secretions that adds onto it, and like wear and tear, the intestines slough off, so they peel off. Is the natural process. They peel off and contribute to the meconium, and then it comes out as the dark green stool that the baby passes. So again, and so meconium, as children are ready to pass meconium when they are close to the time of delivery. So when they are at 9 months or very close to 9 months of pregnancy. Therefore, Meconium aspiration syndrome is rare in children who are born premature or preterm. So it is typical for babies who are born at term, who are born when they have reached 9 months or gone past 9 months. Okay, so what are the risk factors? What are the things that can make meconium aspiration to occur? So anything that will cause stress on the baby while the baby is still in the womb, before the baby was born, causing a reduction in oxygen delivery to the child or blood flow through the placenta to the child, will cause meconium, would cause the child to pass meconium in the womb. Now, not every child that passes meconium in the womb will have meconium aspiration syndrome. Those that pass, again, is not normal. It's not usual. A child shouldn't pass meconium inside the womb. But of those that do pass it, because of the factors that I will list again, some of them will have it clog up the lungs and by some other processes, causing them to have difficulty in breathing that needs medical intervention. So they are the ones that we regard to have had Meconium Aspiration Syndrome. Some children will pass meconium, it will stain the fluid, the amniotic fluid, but they will not breathe it in to cause Meconium Aspiration Syndrome. But some will breathe it in and it will clog the lungs and to cause Meconium Aspiration Syndrome. So we said that the things that will cause a child to pass meconium inside the womb or just as the child is coming out are things that will cause reduction in oxygen delivery to the child and or blood flow to the child. So they include prolonged and obstructed labor. So a woman who goes into labor and the labor lasts longer than it should puts the child at risk. Because once the labor begins to last more than it should, the child is put under stress and the body is going to respond. And the body is going to respond by one of the ways, that's not the only way, but one of the ways, since it's Meconium Aspiration Syndrome we're dealing with, is by passing stool. So imagine, okay, so let's even bring it down to our term. When you go for a new interview or you write an exam, you remember when you're under tension, when you're under stress, most people feel like they want to use the toilet. So that's the same thing. It's okay. I'm likening it. It's not the same, but I'm likening it to it so that you have a better understanding. So anything that puts stress on the child, just like when you are anxious and you're tensed and it's your turn for the interview, the CEO is waiting for you, or it's your turn, you're about to write an exam, a professional exam, you suddenly feel like using the toilet. So the same thing, a similar thing, or rather comparable thing, when the child is put under stress, and what is their own stress is lack of oxygen, lack of blood supply, and a few other things. So they will pass the stool in the womb. So those things that will cause that stress will include when the labor has lasted longer than it should, when there's an obstruction, so the child is trying to come out, but the mother's pelvis is either too narrow to accommodate it, or the child's head is too big to pass through. So there's a disproportion, okay? And the child is unable to come out through the vagina. So that is also a stress. When the mother has hypertension that is poorly controlled during pregnancy, it can cause a reduction in blood flow to the placenta that supplies the baby. And so that will also cause some stress. When the mother has infection, and infection is a stress for the child, because if the mother has infection, the body is trying to sort the mother out, the child also gets infected. It's a lot of stress for both the baby and the mother, so the baby will also be compromised. Now, drug abuse. So mothers that smoke, mothers that take cocaine, mothers that take aesthetic drugs, those things can cause stress to the child and they can cause them to pass meconium inside the womb. Now, how does this come about? So when they have passed meconium inside the womb by what we have explained, remember, the children swim inside some water that we call amniotic fluid. This amniotic fluid is supposed to be clean, sterile, even though meconium too is sterile, but it should not be in the amniotic fluid. So it's clean, it's devoid of infection, the child is free to float around and all that. But when the child passes the poo-poo, passes the poo-poo inside that amniotic fluid, which can occur before the child is delivered, or just as the child is about to come out, the child just passes the poo-poo inside the stool for you, and just as the child is coming out, if the child is compromised enough, the child is going to, remember we said the stress will cause the child to pass poo-poo. That same stress will cause some compromise of the lungs, and then the child begins to struggle for air. Typically, a child will not breathe inside the womb. It's when they have come out. But the child begins to struggle for air inside the womb, or as the child is coming out through the canal and then takes a breath. And when the child breathes in, it's going to breathe in some of that amniotic fluid that contains the meconium. And then that meconium goes and blocks the lungs. The lungs have a lot of channels, a lot of, many millions of channels, tiny short tracks that help to move oxygen through the lungs so that the whole body can get oxygen. So it goes and blocks those tiny. So imagine your straw. Imagine you're drinking smoothie and then a lump of orange pulp blocks the straw. That's what the meconium does. If you're taking orange juice, you expect it to be that is very well blended. I know this day of Fit Farm, we like the pulp, which is good, which is encouraged. But so imagine that the child should be taking that those particles should not be there, and then the child breathes in, and those tiny particles clog up the straw. So you see, it's going to be difficult. It's going to be difficult for you to continue to suck through the straw, except that obstruction is removed. So that's how difficult it's going to be for the child to breathe. So another thing that can cause them to have that problem, apart from it physically clogging up the the lungs, is that it can cause an irritation. It shouldn't be there. Some of us have sensitive skin. If you touch something, some form of cream or soap, you begin to have reaction. So this one shouldn't be there. Anyway, even in normal or abnormal, it shouldn't be there. So in some children, it will cause an irritation of the lungs. And then the lungs will respond by closing itself up, trying to protect itself. So it will close up, oxygen will not be delivered, the child will be making making a lot of effort to breathe, and it's going to be a problem. Another way it can cause it is that it will just cause the lung by itself, even though it's not irritating, but it can cause the lung itself not to function properly anymore. It's like water just floods your house, something just floods, something just comes upon you, you're just dazed, you don't know what to do, you suddenly go numb, so unable to function. So there's some dysfunction. There are things that help the lungs to work. There are some things that line the lungs, some fluids that should be in the lungs. So this mechanism goes and just kind of messes up those fluids, so the lungs loses its function or becomes dysfunctional. So to recap, the ways that meconium aspiration. So to recap, so a child passes stool inside the womb, and if the compromise that caused him to pass the stool in the first place is retained, the child tries to respond, takes a breath, and takes in amniotic fluid with, with the meconium, and it clogs up the lungs, or it irritates the lungs, or it causes the lungs to be dysfunctional. By these three pathways, it will now produce what we call meconium aspiration syndrome. So not every child that passes stool in the womb will have meconium aspiration syndrome. It is not normal to pass stool or it is not typical to pass stool in the womb. But some children will, because of these stressors that we have mentioned. Of those that do, some of them will come down with meconium aspiration syndrome. Those that do not come down will say that they pass through meconium stained fluid, or meconium stained liquor, or meconium stained amniotic fluid. Okay? But what it means is that any child that passes through meconium stained amniotic fluid should be observed and monitored, because the child has a risk of developing meconium syndrome. Okay? I hope that is clear enough. So what are the things that we look out for? What are the things that we'll see when a child has meconium? Okay, we will obviously see that it will be stained with meconium. And we said that meconium is that dark green stool that children pass. So that means the water will be discolored. Typically, that water should be colorless. A few times you just see particles of those white things on the babies that come out on the baby's body when they are born. So typically it should be colorless, but then you see that the water is greenish, it's stained with green, it's green. So that will be obvious. Now, for it, that means the child has been swimming in that green stained water. So you're going to see the nails of the child will be green, the umbilicus will be green, the part of the body may be stained green. And like we said, it is when things don't go right that they have meconium aspiration, that they pass meconium in the amniotic fluid, and that includes when they are not even born. So when you are given the dates and it goes way beyond the dates, that is a risk. So features that show that these children have stayed longer than they should have stayed in the womb will be there: long nails, scaly skins, wrinkling skins. So that's one. Then next thing is that the children, after they are born, some of them are not going to take any breath. They will be unable to breathe. Remember, we said it will cause lung dysfunction. It can cause irritation and it will cause obstruction. So some of them, they are unable to breathe at all. If you don't resuscitate them, that is the end of the child. Some of them will make an effort, but it's going to be a labored breathing. It will be difficult. You'll be seeing here the child grunting, the child, difficult. You may take one breath and then take some time, then take another breath. You can see the lips will be discolored, will be bluish, the tongue will be bluish, the fingers, the nails, the toes will be blue. Then you can see that the chest will look like it's swollen. It's like a barrel. That, like there's something rising inside the chest. It's with barrel shaped because the lung is kind of trapped. Okay? Then they will be breathing fast for some of them. Some will not be breathing even enough. Some will be gasping. Some will be breathing very fast. All of these is an attempt to overcome the obstruction and the problem that is ongoing. And then it can progress if nothing is done. It can progress to the point that the child just wears out, and then that's the end of the child. It can progress to the point that oxygen delivery is insufficient, and it can cause far-reaching, devastating problems for the child. So we've mentioned again, and so that means these children require prompt and immediate care. So what is the way forward? The way forward is prevention. A child should not have meconium aspiration syndrome, really. So it's early prompt care, both before the mother gets pregnant, during period of pregnancy, at delivery, and beyond. So the mother, before she gets pregnant, healthy living, healthy habits. If she has problems like hypertension, diabetes, all those things should be properly managed and properly controlled. Infections should be properly treated. She should live a hygienic life. Risky sexual behaviors should be discouraged because those are the ways that you pick infections and all those things. Then at the point she takes in or conceives, early antenatal care in the right places, with the right doctors, with the obstetrician, a trained obstetrician, because then they can identify the problems. They can identify when you're beginning to your blood pressure is beginning to rise. They can identify when you have infections. They can identify anything that can cause stress both to you and to the baby. And then they're going to handle it promptly and well. So for your own good health and for the health of the baby. And they also are able to say, okay, this woman, you cannot go beyond this time. Your baby may have a problem. They're able to say, okay, this is the mode of delivery that will be best for you. Or, okay, you've been in labor for too long. We need to intervene. Or, okay, we have checked your pelvis. Considering the weight of your baby and the size of your pelvis, it does not seem that your baby will be able to come out through this part. We will need to do a cesarean section, and so that we don't have to go through this. Or then, okay, this is the time you're supposed to deliver. If you have not gone into labor by this date, you should come. We'll have to induce the labor so that the baby doesn't stay too long and now begins to develop all of these problems. So that's the first part. Then at delivery, assuming for some inevitable circumstances, the baby has now passed the meconium, the baby can still be salvaged if the delivery was done in the presence of an appropriate, a well-trained pediatrician. So we can intervene and, resuscitate the child appropriately just within those first golden minutes, those first 5 minutes of life, very critical for these children. Because if it is clogged up and nothing is done, that obstruction is not removed and continued care is not provided, then the child can develop what we call perinatal asphyxia, meaning he's going to have brain damage. And brain damage will cause problem now and cause problem in the future, even into adulthood. Nobody wants to have that, So again, to recap, prevention is baseline. Ensure appropriate health and well-being, health behaviors, good antenatal care, good and focused antenatal care, delivery in the right place. It's not the type that some people will go and do antenatal care in an appropriate hospital. Then when they want to go and give birth, they will now go to somebody who may not be able to take care of issues if it develops. So you do things the proper way. Ask your doctors questions. If you have symptoms in your body, ask questions, complain, say it out so that you can receive help. So prevention, bottom line. But if at delivery it does occur, the pediatrician, if they are present, will be able to circumvent the far-reaching problems. So what are the complications that from this? We've mentioned the perinatal asphyxia with the brain damage and the problems of child did not hear, child cannot talk, child cannot sit, cannot control the head, cannot crawl, cannot walk, cannot speak, and then you have cerebral palsy and all those issues that come with it. Okay, some of them can have lung damage with lung collapse. Some of them can have pulmonary hypertension, and the rest of the problems that can come from this. So I think this briefly, kind of summarizes what Meconium Aspiration Syndrome is. So I think we'll be willing to take questions now or comments from the audience. Thank you very much for your time.
Thank you so much, Dr. Uche. That has been an eye-opening session with you on Meconium Aspiration. Ginika Nwachukwu, you're saying hi, welcome. Thanks for joining us. We are still expecting your comment, viewers. If you have comments, kindly drop it under the video and not on the watch party. Thank you, Doctor. We've learned so much about Meconium Aspiration. Do you have any last words for us?
Okay. So finally, like I said, from early antenatal care and delivery in the appropriate center that has an obstetrician and to take care. Fortunately, in Meconium, you can deliver in place and then send the child to another place. 5 minutes is all it takes to make that call. So you will not have the benefit of that 5 minutes. You will have more far-reaching issues. So make sure that you deliver your baby. First of all, make sure that you take care of yourself and your pregnancy appropriately in the hands of a trained obstetrician. The delivery happens in the hands of the trained obstetrician, and that there's always a pediatrician available in the event of any inevitable circumstances. Thank you.
Thank you very much, Dr. Uche. We really enjoyed today's session. Viewers, hope you learned one or two things about Meconium Aspiration Syndrome. And we've learned how to prevent ourselves from having such. We said we should make sure we go for regular antenatal check and make sure we go to the right places for it. So thank you, Dr. Uche. Viewers, kindly join us same time next week for another interesting edition on ATP Live. If you have questions after the video, you can post it directly on our Facebook group, and our professionals will be there to answer. Bye for now.
Bye, everyone.